Hi, my name's Abby. In this little video that we're making, I'm gonna be the nurse. In this situation, I'm the nurse calling Kelland, the patient, to kind of see and check up how she's doing after she recently visited the ER. So enjoy.
And I'm Kelland, and this is our non-therapeutic therapeutic communication video. Enjoy!
Hi, my name's Abby. I'm calling from the ED department that you recently visited. I'm just calling to see if you had any concerns or anything that we needed to discuss after your visit.
Oh, Abby, so great of you to call. I have actually been having problems with my ankle. It's still sore and swollen, and I mean, it's kind of hard for me to not stay off of it. I got to get around, and I've just been having problems with it, and I don't know that my pain medication has been working well.
Tell me about how you use your pain medicine. Are you even reading the bottle to tell you how to take it? Are you even using any icing methods or anything else to reduce the pain that you're having in your ankle?
I mean, I think I'm taking the medication right, and I know how to read. As for icing it, I don't know how often to do that, or at least don't remember. I don't know, I guess that's it.
So when you left the ER, we gave you a bunch of papers called discharge instructions, and that outlines everything you should do to take care of your ankle and your injury. So it'll tell you how to take your pain medicine and all of that stuff. So you should probably look over that stuff. Just a suggestion.
Oh, okay, well, thanks for your help. Thanks.
Okay, well, do you have any other concerns that you'd like to tell me about?
Well, while I was there, I did overhear some of the nurses standing outside my room talking about me, and I knew they were talking about me because, well, they mentioned my name and they even mentioned what was going on with me, and I didn't appreciate my privacy being violated like that.
Well, I'm not sure how you expect us to pass on your information to the next nurses coming on to shift. But if you'd like to pass that complaint on to my supervisor, I can give you her number. I'd like to briefly go over how the nurse's communication with the patient was very non-therapeutic. For starters, the nurse was very abrasive when it came to explaining things to the patient. She was unwilling to take the time and figure out what the patient was doing to relieve pain. She just, go look at the discharge papers, which is not okay. Take a little bit of time to explain stuff to your patients. Also, with the complaint the patient had, that's very serious, and the nurse was just kind of brushed it off. Talk to my supervisor if you want to. I'll give you her number. That's just definitely not how to approach things. So in this next video, we're gonna kind of fix this and see how the patient's response is different. Hi, Kelland. This is Abby from the ED department that you recently visited a couple of days ago. I was just calling to see if you had any questions or concerns about your care or anything that you'd like me to follow up with. We just want to make sure that you're taken care of. So I'm here to answer any questions if you have any.
Abby, I'm so glad that you called. I really appreciate it. I actually have been having problems with my ankle still being swollen and just hurting, and I just don't know what to do about it.
I hate to hear that you're still having pain. Can you tell me a little bit about your daily routine, how you take your medicines, if you use any icing techniques, and if you keep it elevated or anything?
Well, I am on my feet quite a bit, and I'm sure that isn't good for my swollen ankle, I guess. As for icing it, I don't know. I mean, I ice it when it kind of starts bothering me, so maybe a couple times a day. My pain medication, I think I'm taking it right. I mean, I'm reading the bottle and I think I'm following the directions correctly.
Rest is very important, so make sure you try to stay off of it as much as you possibly can to let it heal. And there's lots of helpful tricks on your discharge papers that we sent you home with that explain when to take your pain medicine, when to ice, elevation, and all that other handy stuff that will definitely help you with your pain. But I hope your pain gets better. And is there anything else I can do for you?
Oh, I totally forgot about those discharge papers. Thank you so much for reminding me. I will definitely take a look at those. And thank you for just giving me the information I need to hopefully let my ankle heal up and get better. As for anything else, there was at one point, I overheard the nurses talking pretty loudly about me outside of my room, and I know they were talking about me because they used my full name and they even mentioned what was wrong with me. And at one point, I even heard them giggling, and I don't know if it was about me or not, but I just didn't really appreciate my privacy being violated like that.
I'm so sorry to hear that. Patient privacy is so important to us here at the hospital. I will definitely take that up with my supervisor, and we will definitely get that fixed. I'm really sorry to hear about that, but I hope your ankle pain gets a lot better. But I hope you have a wonderful evening.